It's now my pleasure, my honor to introduce a great colleague and a good friend, Dr. Mark Gold. As many of you know, Mark chairs the Department of Psychiatry. He is the Donald R. Disney Eminent Scholar and Distinguished Alumni Professor for the University of Florida. I thought about spending a lot of time with his bio, and then I came to the conclusion that we'd rather hear from Mark than about Mark. As many of you know, he has spent a 40-year career helping to bridge the gap between medical education, clinical practice, and research, those same three missions, with the belief that addiction was a brain disease and that all physicians, regardless of their specialty, needed to know and understand their role in the prevention, the diagnosis, and the treatment of addiction. And perhaps most importantly, Dr. Gold received his medical degree. He is a graduate of the University of Florida College of Medicine. Please welcome Dr. Gold.
Well, one of the advantages of being promoted and being a distinguished professor and chairman and UF alumni professor is that you feel like you could just stand here and talk for hours. And I've been told that that wasn't a good idea. So I think I'm going to keep my remarks short for me. To begin with, this is really exciting for me. The people that know me very well, my mother, my friends know that this is something that I've worked towards since 1990. It's a long time. I helped write the first credentials that Shands Hospital accepted for the specialists in addiction medicine. So I remember being the first hire in addiction medicine, working in the cancer center because addiction medicine equaled smoking, and smoking equaled smoking prevention, and smoking prevention meant I should be in the cancer facility. So I have a really long view of this, and with that long view, I'm grateful. I'm very grateful to you guys. We have a world-class team of just wonderful clinicians. And I could name them all, but I probably shouldn't. But I will say this much. Our chief of addiction medicine, Scott Teitelbaum, you met, leads a team of 12 full-time, board-certified addiction medicine faculty, the largest addiction medicine faculty in the United States. And that doesn't even include the addiction psychiatry faculty, like Bill Green, who's over there in his white coat, thank you, and our other addiction psychiatrists who are trained both in addiction and psychiatry. Martha Brown, there's a whole group. I'm going to miss people, of course, so I'm not going to name them, but it just hits me that, we have 10 addiction plus psychiatry faculty, 22 clinical addiction medicine and addiction psychiatry faculty here, teaching, doing research, and providing clinical care. In addition, at the Brain Institute, we have almost 15, one on the way, addiction researchers studying everything from tobacco, opium, physicians' health, and trying to make a difference in translating basic science findings into clinical practice. So we're very, very proud of our group. In addition, addiction psychologists, addiction family work, just addiction. And we really do, Kim White, addiction, child and adolescent psychiatry. Everywhere I look, I'm going to see somebody who's making a big difference, and we're all learning and helping each other. So we have critical mass, a lot of momentum, and how'd that happen? Well, so I'm here alone in 1990 as the first person, but the next big event historically would be Marina Cecchini. She was hired by Shands in 2000. Is that right? So we had a world-class psychiatric and addiction hospital administrator hired to help. And boy, was that useful, because I could actually say, you can't have a destination treatment program without some place to evaluate difficult to treat addicts. And that was, at the time, Vista Psychiatric Hospital. So we had even a locked unit. You needed that with some patients who came in with heart disease, with crack abuse, with all kinds of problems. And we could start the process that we all see now coming to fruition here today with a kind of range of services, not one size fits all, not trying to stick round pegs in a square hole. So patients started to come here. They came from professional sports. Many of you know that fly down from New York, came from major cities around the United States for treatment. And we detoxified people, and then we said, well, what's next? And there really was models for what was next, but we needed support for that. And that support has come. We've studied patient outcomes and helped define what is optimal treatment. Lisa Merlo-Green, who's here, is a co-author with me and the founding director of the National Institute of Drug Abuse and President Obama's former treatment czar on how treatment works and can work so successfully that 5 years after treatment in a place like this, 80% of the impaired health professionals are back at work, drug-free. It's remarkable. So it takes a large group, and we're lucky to have it, of addiction specialists to make recovery possible. It takes facilities, and it takes support. And UF and Shands, the College of Medicine, Shands have provided that for us. We wouldn't be celebrating this opening without that support. You've met the 3 Gs, what we call the 3 Gs. And if you add Bill Robinson to that, and our friend Wayne Tharp to that, you have a whole group that came together and said, okay, what is the best possible environment for you to do your work? So in my talk I said, I'm surprised that we're here in the shadow of the University of Florida College of Medicine, because in another environment, they might have put Florida Recovery Center in Micanopy or High Springs, but they're proud of us, and they want us to do our work in and around the medical school. And you can see on the sign, it says the University of Florida Academic. So the kind of 3 missions that Dean Good articulated so well, we've taken to heart and our calling. While Gainesville is a small town, Florida is a big state. There's a lot of demand for treatment and a lot of need for comprehensive treatment. And we think that the treatment program here with the specialists that we have can make that possible. We also, as you know, with addiction psychiatrists, can treat complex dual disorders, so-called psychiatric problems, depression plus drugs, eating disorders. Dr. Wandler's here, Kevin Wandler, another addiction psychiatrist. Eating disorders can be treated here. And look around. Isn't this nice and peaceful? I'm looking at the trees, and I'm feeling like it's possible for even me to recover, but maybe not. I think this is a challenging time in academic medicine. Our faculty, many of whom are here today, our administration led by Marika Brigham, have done a good job of keeping us balanced and on track and not biting off more than we can chew, and going step by step along the way. And the process is always directed toward optimal patient care, research that makes a difference, research that translates into clinical practice, education of our students, education of physicians in practice. We know just yesterday they were discussing how physicians need education on pain medicine and prescribing pain medicine. Our group has a whole pain track here for people who are addicted to pain medicines. And we also have with Dr. Ricefield, our only UF quadruple boarded physician, a pain evaluation and treatment program. So anyway, I could go on and on. I can't because they have a trap door here. But I would like to thank again the 3Gs, Ed, our administration, Wayne, College of Medicine, Shands, for recognizing the tremendous national need, investing in the hiring of the right staff and faculty to deliver clinical services, and also invent new approaches and test treatments so that evidence-based treatment can be applied to addiction. And, you know, for my colleagues here from the College of Medicine, other chairs, they'll tell you that I'm always saying the evidence base for addiction medicine is better than the evidence base in almost every other specialty for almost every other disease. We know what treatment works, we know how to deliver that treatment, we know how to optimize treatment, and we can make a difference in people's lives, and we're glad that you put us in the game and given us a facility like this that we can do what we've been called to do, and thank you very much for that.